Good day, everyone. Today we'll talk about using Bloom's taxonomy to clarify your intended learning outcomes or your statement of ILOs, especially now in the context of outcome-based learning. So before we proceed, let us review Bloom's taxonomy. You know that Bloom's taxonomy, the 2000 edition, talks about two dimensions, or we'll have two dimensions. We have the cognitive dimension and of course the knowledge dimension. Let's talk about the cognitive dimension. The cognitive dimensions would include six of the domains that we usually use in our formulation of outcomes. The first one, of course, probably you're familiar with: remember, understand, and apply. These first three domains actually are considered the lower order thinking dimensions, while analyze, evaluate, and create are the higher order thinking dimension. So these are the cognitive dimensions. But what exactly do you need to, what would it require to be able to remember, understand, apply, analyze, evaluate, create? Of course, you need knowledge. And that will bring us to the knowledge dimension. So what do you need to remember, understand, or apply, or up the line? So basically, you need to first know about factual knowledge. You cannot you cannot apply anything that you don't have knowledge of, right? Uh, or let's say factual knowledge would be population, statistics, number of bones in your body, and sort of thing. All the anatomical structures that are factually had been verified as such. But we also have conceptual knowledge, like the concept of muscle is different from the factual knowledge of how many muscles there are, or the factual knowledge about bones, number of bones in the body, would also require conceptual knowledge of what bones are, right? Or the difference between a bone and a cartilage, what is an organ, differentiating it from a tissue. These are all conceptual in nature. But aside from that, you also need to have procedural knowledge of how to do things. Let's say, for example, how do you identify an organism microscopically? So probably you need to go to the different steps from setting up the microscope, or if you're a medical technologist, you may go into a level of basically creating the slides, for example. And for other basic competencies like, let's say, collecting blood pressure from your patients. So that would mean there will be procedures, or let's say taking care of wounds or suturing. There will be step one, step two, step three. These are procedural knowledge. So it's important that you know the how before you can perform the how, right? The procedure. It's also important to take note of the additional dimension of knowledge. This was recently added, or I mean, at least the 2000 edition. This was not mentioned in any way in the old 1958 taxonomy, but metacognitive is about knowing about knowing. So now we would like to develop students' own understanding of their own knowledge. How do they, what are the best strategies for them to learn? How will they know that they already know? Why is it important? So that they can develop their own self-directed learning activities, and at the same time evaluate their own performance so that they can by themselves do their own correction or intervention. You don't have to be with a teacher or something else, somebody else. But if you're alone in a remote area, but with access to some literature and some other exercises, you may want to test your own knowledge, right? So as I said, together, uh, there will be a combination of both uh, knowledge and cognitive dimension. Remember, you remember a fact, you understand a concept, you apply a procedure. And if you put them all together, you will be able to analyze patient, for example, or evaluate patient status and eventually create an intervention for that particular patient. But it's not enough that you know about the cognitive dimensions. You also need to know about the clinical skills dimension. You know about knows how. This is the Miller's perspective. Knows. We can say that this probably will be aligned with our remember or understand uh, in the Bloom's taxonomy dimension. And knows how. It talks about you know how you can enumerate the steps, but it's not the same by of what to say, not the same as actually doing the steps, showing how. So similar to the Bloom's taxonomy, we also have higher order in a way, showing how and doing is more appropriate as an we call it as a taxonomy in the context of performance outside of the training room, but rather already performance in work setting. Okay, but it's also not enough that you also have just clinical competencies, knowledge, and the knowledge competencies or cognitive competencies. It's also important that your students um, have the affective competencies. So you have receiving, responding. So you will learn more about this as we go to more specific discussion of taxonomies. But what is important is for you to remember that our outcome statement should actually be able to incorporate the knowledge, the affect, and of course the skill together in the statement. While initially when we're preparing our outcomes, they can be formulated or they will be formulated independent of each other or independent statements. But at the end of the day, you have to put them all together as an integrated statement of outcomes where a skill will have its own affective component, right? You don't just say perform a procedure without respecting patient's confidentiality or respecting patient culture. So these are important elements. So to now proceed to the actual analysis, let me use a matrix. So in this matrix, we'll show you how the cognitive dimension and the knowledge dimension would interact. Say here, for example, talking about this, you remember this for example, for areas of domain: anatomy, cardiovascular, physiology, PE, and sort of thing. That's the procedural knowledge, and then you will have to utilize all this knowledge, from not just from remembering them. You don't want to end with your students just remembering them or understanding them. The ultimate objective is for them to be able to create something out of this. So let's say, for example, in this scenario in the matrix, we have your topic will be management of patient with hypertension, and if you do follow OBE perspective, that will mean you will have to analyze backwards. So the ultimate outcome that we want is for the students to be able to prepare a follow-up plan, for example, for a patient with post-stroke, for example, or with hypertension, or create a management plan for a patient with hypertension. But to be able to do that, we have to go back to all the things needed to be uh, from the knowledge dimension and the competency dimension. So let's say you probably would start with making them remember the normal values, anatomy, cardiovascular system, blood pressure, hemodynamics, how to take blood pressure, which is your procedural knowledge. And then they need to understand all these concepts, like say differentiating, for example, between normal and abnormal, and then how BP taking equipment works, and eventually be able to utilize those understanding of how BP works and the steps involved in taking BP to actually taking BP from real patients. So that will be now applying all the knowledge at the remember understand level. And then since the students are able to take BP from real patient, they should be able to utilize those knowledge about normal values, dynamics to perform or analyze patients' BP for the last 3 months, and then eventually evaluate patient status. So you go into the status of patient. You will now be able to evaluate if the patient is in a certain category of hypertension, and eventually prepare your or create your follow-up and management plan. So together we can add the verb to this one using the remember, understand, apply. So if it's create, basically you will be able to do a create level outcome, right, statement. So if you are now to go about metacognitive, then talk about how do we use this knowledge of the different procedures, knowledge of how to take BP in assessing on performance. Let's say, did I do it correctly, or did I do it the wrong way? So because you know, then you will be able to analyze, and you probably would recognize errors in procedures, and the errors will be addressed by yourself. You develop your own performance level assessment and prepare a personal plan to master competencies. Probably will ask a classmate, student will ask a classmate to act as patient, and they perform together, evaluate their performance, they go role playing and sort of thing. These are all metacognitive in nature. So role playing in a way are not only strategies for learning procedures, but also strategies to master and appreciate own performance level, and hopefully be able to develop personal plans for improvement. But as I said, from this you can easily now produce more than about 10 outcomes. Let's say, for example, from create, and you have this follow-up. So at the end of the module, because you have a follow-up there, formulate a follow-up plan, right? You added a verb, the verb that you will just formulate. And then you can also say prepare a management plan. So the verb that you use will be prepare, and then you just added a verb to the statements to have initially in your matrix. And you can add a sub competency or a metacognitive outcome that will be prepare a personal plan to master related competencies. But this is basically individual level, no? Meaning it's not really for you to grade, but for the students to be able to assess themselves towards the development of self-directed learning competencies and lifelong learning competencies. So going back, then we can actually look at backwards and see what we can formulate out of that. So to prepare a management plan, you need to the student should be able to classify patient. That will be evaluative, right? Classify patient as the type and stage of hypertension. But to be able to classify, you need to be able to collect BP history, and to be able to collect BP history, you need to take your blood pressure from your patient. And eventually, what you notice that from that already we have 1, 2, 3, 4 objectives or intended learning outcomes, 3 levels of intended learning outcomes, from the lower order to eventually the higher order creation. And you can also formulate more outcomes by adding verb to the understand elements that we wrote here, and then also for the remember, you just add also the verb, like say list the anatomical structure, discuss blood pressure, and define hemodynamics, or enumerate the steps. So these are all the lower order outcomes. So as I said earlier, you would have produced already about 30 or 10 outcomes from this one. As I said, you can also add metacognitive outcomes, like the student will be able to recognize own errors in performing the procedure. You know that if they know how, then they should be able to assess themselves. And then they can make the necessary individual plan to improve further their procedures.